Good morning, good afternoon, good evening, esteemed colleagues. My name is Jos Vaassen, and I work at the Independent Evaluation Group of the World Bank. And it is my pleasure to welcome you to the fifth seminar of the IPDET mini-series, which is the fifth in a series of 7. And those of you who are familiar with it, I'm sure that you are continue to following this series. As you may know, the IPDET mini-series is part of IPDET's broader offering in 2020, which also includes an IPDET hackathon, which was conducted the past summer, and also involves a series of online workshops which are currently ongoing. Today's seminar discusses a very important topic that may be of interest to many, if not all of us, which is the role of evaluation and also monitoring in the context of the COVID-19 pandemic. We have for you quite an interesting panel of speakers lined up who will look at this theme from different complementary angles. Before I turn to the speakers and the program of today, let me briefly give you a short introduction about the topic that we are dealing with today. So as we all know, the COVID-19 pandemic has become a truly global pandemic. The pandemic itself and the corresponding government measures to mitigate infections, they have affected our lives locally, nationally, and also globally. And as we know, the effects of the pandemic go far beyond the health system and the health of citizens, and they also affect our societies more widely. For example, through the economic and psychological effects of lockdowns, and also the effects of the related government-imposed behavioral measures and restrictions. So M&E is more important than ever in such a context. And why is this so, and how does this work? This is the topic of our discussion today. To give you a feeling of the topic, let me talk about what we need to get a better understanding of COVID-19, the interventions that we implement to influence the pandemic and their effects. First of all, we need good data to understand and monitoring the following things. We need data on how the pandemic evolves. We need to know the evolution and the infection rates, hospital intakes, the effects of the pandemic on morbidity and mortality, and so on. We need to have a good idea about how the government intervenes to support the health system and the health of citizens, for example, by setting up testing facilities, by distributing face masks, by boosting the readiness in terms of equipment and staff of hospitals to take care of increasing number of patients, and so on. We also need data on how the government intervenes to impose necessary behavioral rules and restrictions on travel and movement, and potentially even partial and full lockdowns of schools, businesses, and government services to stop the spread of the virus. We also need data on the various effects that these measures may have, not only in terms of potentially constraining the spread of the virus, but also in terms of how they affect the economic circumstances of businesses and citizens, or how they affect the emotional well-being of citizens, and so on. And finally, we also need data on how the government then again intervenes to mitigate such negative effects by providing, for example, support to the private sector or income support to people that temporarily lose their incomes, and so on. So quite a lot of data that we need to have a better understanding of COVID-19 and how we try to influence it as governments and citizens. So in the list that I mentioned, there are data that refer to the realm of outcome monitoring. These are the phenomena that we are trying to influence, such as the reduction of the spread of the virus, and also the minimization of the negative effects of the local, national, and global restrictions. And also data that relate to the realm of implementation monitoring, which is about what we are doing, what is the government doing, what are other actors doing to influence these outcomes, such as supporting the health system, building awareness among citizens, or providing a fiscal stimulus to businesses and citizens. So outcome and implementation monitoring help us to provide the data. Now, reflecting on these data and understanding the patterns between the data, along with a thorough understanding of how interventions work, this brings us to the realm of evaluation. And evaluation is the practice of determining, among other things, what works, what doesn't, why, how, and under what circumstances. So evaluation builds on implementation and outcome monitoring data, and together this can help governments and other stakeholders to better understand things and make better decisions. So this is the broad context of the role of M&E in these times of COVID-19, and this is what we are going to discuss today. Jessica, if you could please show the next slide. So the structure of today's session is the following. We will start with 3 consecutive presentations by our esteemed panel members, and we will then go into some discussion with the panel members, and at the same time you will have an opportunity to send us your questions. And after the presentations, I will explain how you can send us your questions. You can then also vote on the questions that were submitted, and we will then bring the questions with the most votes, as well as any additional questions that we have space for, to the panel, which allow us to have an interesting discussion on the topic of today. We have 3 very interesting presentations for you in a row. First of all, we will start with Reinhard Stockmann. Then we have Bassirou Chitou, and finally Albert Tuyishime. I will introduce each of the speakers in more detail just before their presentation. So without further ado, let me start now by introducing the first speaker of today. Our first speaker is Professor Reinhard Stockmann, who is Professor of Sociology at Saarland University, as well as the Director of the Center for Evaluation, CEVAL, in Germany. He will provide us with a quick introduction on the potential roles of monitoring and evaluation in the context of COVID-19. And among other things, he will elucidate how evaluations can contribute to the understanding of intervention design, implementation, and impact. He will then also provide some examples in the context of COVID-19. Reinhard, the floor is yours.
Yeah. So, well, I like to talk a little bit about the usefulness of monitoring and evaluation in the context of the COVID crisis. And Jessica, please, could you show us the next slide? I hope this will work. Okay, yeah, it looks like. Yeah, look, since the emerging of the results-based management, as well as the idea of the evidence-based policy, evaluation has experienced in a worldwide boom because of these new forms of management. Impact-related data are needed by administration and politics, and monitoring and evaluation are the instruments that can provide a science-based, valid, and reliable data, which can tell us something about the presumed correlations and expected impacts during the planning phase of an intervention. And during the implementation phase, monitoring and evaluation can help to establish measures of all kinds as efficiently and effectively as possible. And subsequently, monitoring and evaluation provide evidence for the intended and unintended impacts. Now, monitoring and evaluation systems are not the only suppliers of evidence that can be used by decision makers in politics and administration. Next slide, please, Jessica. Of course, there are other sources, and please, again, a next click, Jessica. There are other sources, such official statistics, which tell us something about the infection rate, mortality, or distribution areas during the COVID-19 era. Sources such as the media that report about it. Other people we trust and who tell us about their experiences and views also should not be underestimated. And all this evidence is assessed on the basis of our own knowledge, our own experiences, our preferences and priorities before a decision is made, right? So what is the advantage of evidence as a result of evaluation in this decision-making cocktail? Next slide, please, Jessica, thank you. Well, the answer is to be found in the fact that evaluation collect, analyze, and assess data according to scientific standards. This process is intended to ensure that the information is of a particular quality, which is why it is distinguished from subjective views. Since the data and assessment criteria are disclosed in an evaluation, everyone can understand why the evaluator arrived to a certain result. In other words, evaluation creates transparency and thus the basis for a fact-oriented dialogue. Unlike a classical science, next slide please, where it is about improving the understanding about the world and how certain things function, evaluation always is benefit-based. Is always benefit-based. I think that's most important. That means that evaluation must not only be based on scientific standards, but above all, it must be useful, especially for the commissioner, who is ultimately the one who pays the bill. There is still much that could be said that is fundamental to evaluation, but instead I would like to concentrate on this utility function of evaluation and explain the question already mentioned at the beginning. How can evaluation be useful during the individual phases of an intervention, be it a program, a law, or just an individual measure in the context of the COVID-19 pandemic? Let's take a very simple example, the wearing of mouth and nose protection masks. Please, the next slide. Which task would an evaluation fulfill during the planning stage of such a measure, which should lead to, let's say, a legal regulation? Ted, do you still hear me?
Yes, you're back. You were muted one instant.
I don't know why.
Please repeat. Yeah.
But I have seen it. Okay, please, the next slide, Jessica. So again, so what are the tasks of evaluation in the planning stage? Well, in general terms, such an evaluation in the planning stage is called an ex ante evaluation, and this kind of evaluation should help us to support the planning process to establish a sound basis for an optimal implementation process. And this includes questions as, is the intervention goal, which will later be the object of an evaluation, precisely formulated? What are the assumptions, the theory of change behind the intervention? In our case, why should the wearing of masks reduce the infection rate? What criteria or threshold values should be set for measuring success? So in our case, by how much percentage should the infection rate be reduced? Do the planned activities build on each other logically and give reason to expect that the goal will be achieved? And the initial situation is documented in the context of a baseline study before the start of an intervention to provide a basis for later comparisons, for example, when the impact is to be measured. In our case, how high is the rate of infection in certain population groups, age groups, and so on, before the implementation of the measure. The next slide, please, Jessica. So what are the benefits at the implementation stage? Generally speaking, an evaluation should identify implementation problems and their causes and propose solutions during the implementation phase of an intervention. Among other things, such an evaluation provides answers to the following questions. Has the review of monitoring data shown that the implementation process is proceeding as planned? What problems are occurring? If you look at our mask example, are there people refusing wearing masks? Why? Are there enough masks available to equip them and so on? And what are the causes for the problems and how could these problems be solved? Does the intervention, the reduction of the risk of infection by wearing masks still correspond to the current state of knowledge, or would other measures be better suited for this? These are just a few examples what evaluation can assess, can analyze in the implementation stage. Okay, then let's have a look at the benefits at the impact stage. And for this next slide. Finally, it is the decisive question of whether the intervention goals are achieved, whether the intended impacts have occurred, and whether there are unexpected, unintended impacts. So in detail, an impact evaluation could answer questions like to what extent could the infection rate be reduced by the mouth nose protection in comparison to a control group without the protection and compared to the initial value of the baseline study? How effectively was the intervention implemented? Does everyone, young and old, men and women and so on, behave in the same way and follow the guidelines? Who might still need to be convinced? Could financial penalties increase the effectiveness of intervention? Or other question would be, what unintended consequences have occurred? For example, wearers of the masks feel uncomfortable, communication problems occur, and so on, and that make everyday private and professional activities more difficult. Is it that way or is it not like that? Do conflicts arise because of the intervention in society, supporters of wearing masks against opponents? I hope that these few examples have made it evident how evaluations can help to generate valuable information, evidence to help decision makers in politics and administration to take rational decisions during the planning, implementation, and impact phases of an intervention. Finally, I would like to briefly explore the question of whether, and as far as it is known, evaluations have contributed to addressing such and similar issues that have been raised in the context of the COVID-19 pandemic. From my point of view, the answer to this question is rather unsatisfactory, at least if one wants to answer the question in the European or especially in the German context. I have chosen, please the next slide, I have chosen two examples that moreover very clearly show the difference between classical science and evaluation. So for example, the German press agency reports that genetic researchers at the Max Planck Institute in Leipzig have found that there's a connection between the proportion of Neanderthal genes in the genome and the severity of COVID disease. This means that people with this gene variant, therefore with a high proportion of Neanderthal genes, require respiration 3 times more often than those with a low proportion in this genome. Okay, what can we do with this finding in practice? Not much. But that actually is not the decisive question here, because these are results of classical science. But it is decisive if you are dealing with an evaluation. It must produce results that are useful for decision making. And for this, I will give you another example. Next slide, please. Various German universities investigated whether the obligation to wear masks leads to measurable effects. And to do this, they compared the development of infection rates in similar cities where the obligation to wear a mask had been introduced at varying times. The result is, the earlier the obligation to wear masks was introduced, the lower was the infection rate. In those cities where the wearing of masks was promoted additionally, the figures were even better. So the conclusion of the scientists it is worthwhile to wear masks. There are a number of studies of this kind, but in most cases there were not classical evaluations when measures were tested in order to check their effectiveness and only then to establish them nationwide. Next slide, please. Currently, there is a heated debate in Germany, for example, about how classrooms in schools should be ventilated in winter, or whether the recently imposed ban on accommodating people from so-called risk areas will contribute to a reduction of the infection rate. Whether the closure of restaurants and bars, the prohibition of serving alcohol, the imposition of curfews, contact bans in old people's homes, or the limitation of the number of people at private parties really have the impact claimed by politicians has not been proven by any evaluations, at least in Germany. As a result, these measures, which are of course unpopular in society, have only a very limited basis of legitimacy. Since there is no evidence that these measures contribute to reducing the risk of infection, many people question them. And therefore, evaluation could not only help to examine and to optimize the effectiveness of such measures before they are introduced on a broad scale, but also provide a basis of legitimacy for politicians' decisions and to increase social acceptance. So for me, an interesting question for discussion is, therefore, what is the reason for the fact that so far hardly any evaluations were systematically implemented for the measurement of the effectiveness of individual COVID measures, at least not in Germany, and so far as I am aware, also not when it comes to Europe as a whole. But I'm very curious to hear in the following discussion how the situation looks like in other regions and countries. So thank you very much for listening. And I hope you could understand me.
Thank you very much, Reinhard, for this very interesting kickoff of our discussion today. Esteemed participants, I request you to hoard your questions as we are immediately continuing with our second presentation. And I'm inviting now to the floor Basiru Chitu. Bas, he is a biostatistician, recently has been consulting for the WHO in the Eastern African region on M&E issues in the context of COVID-19. He has also been a member of the IPDET faculty, and he is also Associate Dean of the African School of Economics in Benin. Bas, he will talk about some of the challenges in designing and using evaluations in the context of COVID-19 response, and he will do so against the backdrop of his extensive professional experience in various countries, and more recently also in Eastern Africa in the context of the COVID-19 response. Bas, the floor is yours.
Thank you, colleague. Thank you, Professor Reinhard, for a nice introduction to our subject. Next, please, Jessica. So my role has been to support government in the response of COVID, and specifically to manage data collection and analysis, and work with international partners and national authorities to design effective monitoring evaluation for COVID-19. Next. So today I will discuss with three questions that are on this slide, and as you can see, but to focus on the second one, how do we design a utilization-focused evaluation in the COVID area, and give some hint on how we collect reliable and valid data. Next. Now, there are many program intervention for COVID, but let me focus on two major ones because of the international scope. The first one is the World Bank Health Support Program, which is designed to give most countries in the world about 160 billion over the next 15 months. And the link here give you all the detail. But the goal of this program is to help countries protect the poor, support businesses, and aid for economic recovery for most countries. The second one is the WHO monitoring evaluation framework. And this framework is to establish international coordination and operation to support countries and strengthen the health system of countries in order to help them respond effectively to COVID-19 and beyond, and accelerating priority research and innovation. And detail can be also found at this link. Now, the aim here is to collect data and support strategic thinking, operational tracking, real-time evidence-based decision-making, and advocacy and transparency between beneficiary, government, UN agency, and so on. Now, you will agree with me that these two programs of this nature require a lot of resources. So as they have been implemented, it's now time for us to evaluate them. So next, please. So the previous slide showed you that there is a need for evaluation, but I will give you here 7 reasons why evaluation is useful in this area of COVID-19, but also provide you with 1 or 2 examples. The reason I listed, as you can see, first, you will agree with me that this pandemic is fast-moving, changing, and there are vulnerability of many public health institutions, as well as social and economic institutions. There is a need to learn what is working and what is not, as mentioned by Professor Reinhardt. There is also a need to quickly collect data and analyze them, because the pandemic is fast moving, because measures are changing, because people are not following, are tired of government measures. There is a need to translate the finding into policy and action, and then in order to make real-time evidence decisions. There is also a need for advocacy and transparency because of the many resources that have been used, especially the financial one, as the one by the bank and by WHO. Now, let me illustrate this with the very first example. So, one country in East Africa, the government decided that they'll provide 300 beds for each of the 40 regions in the country. And as you can see, this requires that they raise a lot of funds for donors and from the public fund. Now, 300 beds per region for 40 regions is a lot. So there was a need to find out if this is a relevant policy, a relevant intervention, and it would be very useful for all regions in the country. So we collect the data, we analyze it, and to find out that only half of the region carry 95% of the burden of COVID. There are regions where you have no COVID, or 1 or less than 10. So in those regions, do we really need 300 ICU beds, while other regions have more than 10,000? So you can see that an evaluation here is useful to say with evidence that the intervention is not supported and that we need to realign the fund that we have. So next, please, Jessica. So now that brings us to the next question. So we see that evaluation is useful, but now how can we design an evaluation that is utilization focused? Now there are many frameworks for doing that. The most popular is one designed by Michael Patton in 2013, but currently there are three main ones that I want to focus on. The first one is the Better Evaluation When-Goal Framework that categorize the activity, the task of evaluation into 7 categories or 7 clusters and color coded as you can see on my screen. And the detail can be found here for sake of time. So the 7 are manage the evaluation, define, frame, describe. And what is nice is the 6 and 7 are synthesized, report, and support use. So the support use is the most important part. The next one is the UNFPA adapting evaluation to COVID pandemic, where we provide 5 guidelines, as you can see on my screen. As Professor Reinhardt mentioned, the first is to find what is working, why, for whom, and under what circumstances. The next one is to design an evaluation with human-wide based, equity-focused, and gender responsiveness. Here, in one of the evaluations, we find out that among the people at high risk, there were more people at high risk in men than in women, and the difference is 2 times higher and is significant. So in designing policy, we can translate this one into policy where attention should be paid to men, especially in the older age, 50 and above, without forgetting the female. The next one is to comply with no harm principle for all stakeholders. And the fourth one is sharing, learning and sharing and adapt the finding, especially in the case of COVID where things are changing so fast. The final one is to strengthen coordination between UN agency, partner, and national evaluation capacity, especially the youth. So detail of this framework can be found in the link provided. The last one is the one designed by the IEG group, and thank you, Joss and Marina, for this. This framework really brings to front the real challenge we all face in pandemic, especially is what is the most important, what aspect of the evaluation questions should we focus on. So, and that was the first point of this framework. Like currently, there is a debate between continuing or improving the testing capacity for every country, or moving to accepting that we have reached a plateau, that the pandemic is declining, so that we can focus more on the economic support measures for the most vulnerable. And this again, an evaluation of the current intervention should choose which scope, which angle we should focus on, and that will provide most value for the resources that we are putting in the evaluation. Now, in an evaluation, there are two aspects, what is called the portfolio review and analysis. This, in the term of a pandemic, can be still done, while things like focus group discussion or face-to-face interview are hard to be done because of the lockdown, of difficulty of traveling around, or even the stress associated to travel. So that's why the third question is, can we find way around those activities, those tasks that are no longer feasible? So there are many ways that are provided. One can do either a phone interview or online interview or a wearable camera and other techniques that have emerged. The fourth one is to use alternative source of evidence like geospatial, financial, social media. And the detail for this framework can be seen in the link below. Next. Now, in the time of COVID, there are two major issues or range of issues to be addressed, and so that our evaluation can be utilization focused. Let me do the one on my right hand, the panel on my right hand. First, the risk, communication, and engagement. Now, in a time of pandemic, and in all pandemic, there is always rumor. There is always rumor. Either there is a flat denial, or there is a sense that the pandemic is only valid for a certain group of people, or the pandemic is man-made. So in the case of COVID, a proper utilization-focused evaluation should pay a great attention to the risk communication and especially community engagement. Because at the end of the day, it's the community, it's the people who are affected by the pandemic and who will be affected by our intervention. So a proper risk communication is important, but also the fact that to gain support from the community champions, like chief of village or a community influencer, but also there is a need to design a proper community engagement to address issues and concerns from the community. So now let's go to the left panel. Yeah. The other issue is how to elicit the government support all around the evaluation, but also during the final phase of utilization. So in the case of COVID, we have seen that there are a lot of models have been proposed. There are many issues with data sharing and data collection. But the most striking one are the fact that even from reputable institutions like Johns Hopkins and the London Medical School, sometimes the models provide conflicting results. We have seen the two major big studies that have been retrieved from our reputable journal, The Lancet. So these incidents cause the authorities to doubt the result, the finding of our evaluation. So how the main concern for an evaluator will be how to handle those contradicting findings and make the evaluation more attractable for health authority government authority. So that requires us to align the finding of our evaluation with political message, but also on board early and along the process of evaluation, the end user to our evaluation. Next. Thank you, and I'll stop here. Over.
Thank you very much, Bas. Very interesting presentation. We will now proceed with the third and last presentation. And it's my pleasure to introduce to you Albert Tuyishime, who is the manager of the Planning, M&E, Health Information Systems and Strategy Division at the Rwanda Biomedical Center. Albert will talk about the specific case of Rwanda. We will first talk about the national response to COVID-19 in Rwanda, and subsequently he will discuss how the health sector M&E system works and helps to inform decision-making. The floor is yours, Albert.
Thank you very much, Jos. Thank you, everyone. It's really a pleasure for me to join this very important discussion or exchange on monitoring the evaluation in the context of COVID-19 pandemic or any other crisis. Next slide, please. As we all know, toward the end of January this year, the outbreak of COVID-19 was declared a public health emergency of international concern. Immediately in Rwanda, we developed a national preparedness and response plan to guide and help in coordination of our response to this pandemic. And back in March, specifically on 14th, that's when we recorded our first case of COVID-19. Next slide, please. The National Preparedness and Response Plan was developed to guide both our preparedness, early detection, as well as response to this COVID-19 pandemic in Rwanda. And the main goal was to enhance the capacity of Rwanda to prevent, timely detect, and effectively respond to this COVID-19 pandemic in Rwanda. This plan was built around 6 objectives. The first one, to facilitate coordination and strengthen intersectoral and intrasectoral coordination, as well as engagement of partners. The second objective was to enhance the national capacity for prevention, prompt detection, and timely response. Thirdly, to create and raise public awareness. And fourth, to improve logistics management for swift and smooth operations in the implementation of our interventions against this COVID-19. And the fifth objective was to ensure the enforcement of safety and security measures. And finally, this plan had the objective to mobilize resources required for the implementation of the planned interventions. And in order to implement this plan, there was a need of a coordinating structure that was going to help coordinate, but also timely allocate available resources. Next slide, please. This structure was put in place in order to coordinate at national level, with the different teams with the specific tasks, but also with the coordinated reporting, but also synergized way of working. In this coordination structure, I have to highlight a team of experts called Expert Advisory Team. This is a multi-sectoral team bringing together experts, scientific experts from different institutions, sectors, academia, as well as partners. And the main task and role for this expert advisory team was to advise the government in terms of scientific evidence, but also coordination of any research or study or evaluation efforts related to COVID-19 in Rwanda. Next, please. Right after putting in place that coordination structure, then the government of Rwanda started implementing some key actions to manage the pandemic, starting with implementing strategies for case identification, testing, contact tracing, quarantine and isolation, and case management. Preventive measures were implemented to limit the spread of infection. Treatment centers and quarantine centers were established at both national and decentralized levels. The government stressed on the community engagement while working on increasing the awareness, communicating, and availing the needed information to the community. And some of the specific interventions were implemented, including the countrywide lockdown, as well as localized lockdown, management of imported cases, and most recently, we started the implementation of home-based care for COVID-19 patients. Next slide, please. All these interventions, and as discussed with in the previous presentation, one of the most important elements is the data collection as well as data reporting for timely analysis to inform decisions. For this COVID-19 pandemic in Rwanda, the reporting system has been integrated into the existing reporting system, which is built around the administrative structure, starting with the community level, where we are having community health workers, health posts, health centers, district hospitals, provincial hospitals, and referral hospitals. And each level has got a well-defined package of services to provide, as well as specific reports and well-defined frequency of submission for those reports. So in Rwanda, we tried as much as we can to integrate this COVID-19 reporting into the existing reporting system while making it real-time reporting system as much as we can. Next slide, please. Here I'm trying to share with you the data flow where we are having the lower level, the community level, submitting the reports to the health center or clinics. These clinics consolidate and submit directly into the health management information system, which is the same case for hospitals. Here I have to emphasize on the role of each level in terms of giving feedback to the lower levels in its catchment area. Even if we have facilities reporting directly into the electronic management information system, each level has got this mandate of giving feedback to the lower level in terms of timeliness, completeness, as well as any mentorship needed for data quality improvement. Next slide, please. Even if we tried as much as we can to integrate the COVID-19 reporting system into the existing reporting system, some of the M&E activities have been adjusted. I can mention some of them here. The data quality, the regular data quality assessment exercises and teams have been reviewed and brought to a lower frequency of having them conducted. Some of the monitoring evaluation trainings and mentorships have been dropped or repurposed. Most in-person M&E coordination meetings shifted to online meetings. Some new specific surveys were introduced, including drive-through testing in high-risk groups and areas. We had our monitoring and evaluation teams at facility level, combining both COVID-19 reports with the submission of other routine reports. And we had also a regular analysis of COVID-19 related calls in the call center, which was quite new, depending on this COVID-19 pandemic requirements, if you can call. Next slide, please. All of this have been put in place in order to timely avail data to inform decisions at national or local level. Here I can mention some of the decisions made based on data available. One, a countrywide lockdown has been implemented based on the pandemic dynamics and the epidemiological profile. And after this countrywide lockdown, we even experienced localized lockdown, also based on the data we had for some specific areas in our country. We also had quarantines and treatment centers opened in different areas of our country based on data. We had resources mobilized and allocated depending on the dynamics of the pandemic and the target population, but also areas affected. And also we had some specific or targeted testing or surveillance activities based on the data available. Next slide, please. We agree the evaluation is even more critical at this time of crisis or pandemic, because it does provide us with the evidence on what works, why, for whom, and under what circumstances. For this, we had some circumstances where we, based on some evaluation efforts to inform our next moves or our next steps. Here I can give an example of local versus imported cases. At some point, we had an increase in imported cases, and we had the same treatment centers, and we shifted to, in order to have treatment centers for imported cases near the borders, and this has really paid off because we immediately experienced a decline in new cases following contacts with imported cases. The second evaluation we had is the evaluation of impact of COVID-19 on service deliveries in health facilities and community, with a specific focus on reproductive, maternal, newborn, and health reproduction. And this led to some adjustments on the service delivery channels and ways and packages. And finally, we have this home-based care for COVID-19 patients that has been preceded by a pilot evaluation before we scale up countrywide. From this, we have some lessons we learned. Next slide, please. One, in these times of pandemic or crisis, one has to leverage on existing resources and capacities to the maximum. Here, I can cite the expertise in terms of monitoring and evaluation from academia partners, private sector, wherever it is. Once you have these resources in country, it's always good to start with putting together these experts and leverage on their knowledge and scientific expertise. The second lesson we learned in this monitoring and evaluation area, a multi-sector approach is always an added value to make progress, especially in the case of this COVID-19 pandemic, where not only the health sector is affected, but all the sectors in a country have been hit by this pandemic. With this, I thank you very much and welcome any question or comment. Thank you very much.
Thank you very much, Albert, for a very helpful and very interesting presentation on a concrete example of a national COVID-19 response. Next slide, please. So, esteemed colleagues, may I ask you now to put your questions into the link that we provided to you, the Speak Up link. You can also vote on questions so we can bring them into the panel debate. I have seen that some of you have already put questions in the chat. I hope you don't mind if you copy and paste those questions in the Speak Up app so we can really take up the questions that are really of most interest to you and put them to our speakers. So while you are doing this, you are putting your interesting questions into the Speak Up app. We will go for a quick round of questions and answers to our panel. And I will ask the panel members to be as concise as possible in their responses. So let me start with the first question to Reinhard. This is a question that, Reinhard, you mentioned yourself in your presentation. You were stating that you were a little bit surprised, or you were struck by the fact that there were relatively few evaluation studies on particular interventions on COVID-19 in Germany and in the European context. Could you think of some reasons why this is the case?
Okay, first of all, a test. Do you understand me? Can you hear me? Yeah, you do? Okay, that's fine. Okay. Well, I think actually it is not so much surprising because evaluation does not play really a very important role in our political and social systems. As you know, we have done this, evaluation globe project where we like to find out how evaluation is institutionalized in different countries. And we are ready now to say something about Europe and the Americas, North and South America. And the results are quite similar. And they show us that, well, there's a different degree of institutionalization if we look at the legal regulations, but if we look at the practice, there is a big gap between the legal institutionalization and really the use of evaluation. So actually, even if Germany, as example, has a relatively high degree of institutionalization, there is still a lack of understanding of evaluation in the society, but also in the political system. So if you have a look at different indicators, you could see that. And so maybe it's not so much surprising that also now in the COVID crisis, there's not so much evaluation. And I have to, in addition to what Albert said and what Basiru said, of course, there's a lot of monitoring in our countries. There are also expert groups, interdisciplinary expert groups. But if you look, who is in such kind of expert groups? These are not evaluators, mostly from the medical sector. Of course, also some sociologists, but not specialists in the field of evaluation. So we do a lot of monitoring, but it comes to evaluation, okay, I would say there are some things done. They look very close to an evaluation, but they are not conducted by evaluators, but mostly by people from the medical faculty. But they are not evaluations in this classical sense that we, at the beginning of a measure, we would like to find out what's the logic of the measure and to do a baseline study and things like that, then to find out afterwards if there's really an impact or not. That's really something what's missing. And again, if you ask why is that, I think it is also quite comfortable for the politicians if they do not know so exactly, because they can say, okay, we do this or we do that, and we are convinced that it will work, even if this has not been evaluated or assessed. In some regard, I must say that the politicians also like this conspiracy theorists, not terrorists, conspiracy theorists, who likewise come up with a statement without proving them. But I would say there's one significant difference. While the arguments or opinions of the politicians on the effectiveness on the measures they enact could still be verified, those of the conspiracists are so grotesque that they could not even be verified. So I think we would have a chance, but we are, at least in Germany, we are still waiting that the evaluators could participate in that process.
Thank you very much, Reinhard, for this quite elaborate answer. Let me now ask a question to Bas. From your experience working with governments in the context of the COVID-19 pandemic, do you think that the pandemic and the need for data to inform policy, that this may incentivize or has incentivized governments to invest more in data systems and in data management? Do you see this occurring, or do you think this will happen? Over to you, Bas.
Yes. Can you hear me? Okay.
Yes.
The pandemic show or reflect the need for accurate data. Now, what has happened? Yes, there is a lot of data that have been generated, but there are two major events. The first one is the sharing of the data so that an average researcher can check the accuracy and the usefulness. So many countries, for some reason, have kept their data for either political reason or any other reason that we don't know of. And sharing has been a challenge. The second is collecting the correct data. And what do I mean by that? In some countries, they collect data, but there are 95% missing data on key indicators. So as an evaluator, you are confronted, can I use such data and what do they reflect? Or do I have to go, do I have to find another means and collect it myself so that the degree of accuracy? So we have those big two challenges that need to be addressed if we were to tackle the pandemic in the right way. Now, there are many data currently, but they are not useful because of missingness or because of bad recording and other issues. Over, Joseph. Did I answer your question?
Yes, thanks. You pointed out some of the challenges in the data. Yes, I think we will have to see how the lasting effect of COVID-19 will turn out in terms of demand for better data and data systems. That is an empirical question I think we are all interested in. May I now ask one question to Albert? So you mentioned three very interesting examples of evaluations being conducted in the context of COVID-19. Do you think that the pandemic has increased government's demand for evaluation? Are decision makers asking for evaluative evidence? Over to you, Albert.
Thank you very much, Jos. Exactly, this pandemic has really increased the need or the appetite from the government for more evaluations, because what we've seen specifically with this pandemic, without data, without evaluating any intervention we are conducting, it's hard to expect any positive feedback or outcome. So for us, we've really integrated evaluation in our regular and routine review, or when we're about to propose new interventions. This has to be backed with either data or evaluation efforts. Yes, this has really increased the appetite of evaluations from the government. Thank you.
Thank you, Albert. In the meantime, we are getting some questions from the audience. So thank you very much for that. Let me ask one question, starting now with Bas. So given the urgency of collecting data to be able to respond to what needs to be done during the pandemic at real time, so how do you verify the accuracy of data that is forwarded, that comes from different agencies or that comes from different levels in the system? Over to you, Bas.
Yes, very, very interesting and challenging question. One of the ways to verify the accuracy is triangulation. That's where the need of working in collaboration with many agencies and research institutions is important, because of the restriction imposed by the pandemic. Is also good to build national or local, not national, local capacity, so that when the data is collected with a certain degree of accuracy, and then added other sources to triangulate, like World Bank data or any official data or previous pandemic and see if the data make any sense at all. Now, the other thing is the usual data analysis technique to see the pattern of the data and detect any outliers in the data and try to explain it. Over.
Thank you, Bas. Another question that was posed was asked for the Rwandan context, but I will ask you a different question later on, Albert. Let me ask this question in a different way to Reinhard. You were talking about the paucity of evaluation studies on COVID-19 interventions. How could you give us some ideas about how, given the fact that we are really in a data-driven and a data-high environment around COVID-19, how evaluation as one of the pillars of evidence for policymaking, as you explained, how evaluation could play a bigger role? How could evaluation be taken more seriously as a pillar of evidence for decision makers?
Okay, thank you very much for this question. I think the second example I gave you, what is a real example where there was a kind of evaluation, is how much it makes sense to wear masks. And I think that's a classical example how evaluation could help. So if I would criticize that in a methodological way, I would say, well, it is not clear if the cities, for example, they have selected if they are really comparable. So they just said, okay, the first cities who are supposed to wear a mask, the earlier ones, they compared with the later ones. So that's not really a systematic evaluation as we understand the term, I would say. So it's like that, for example, with an experimental design, to say, okay, there are cities where where masks are not wear very often, for example, even if there's the obligation. We know, for example, in Berlin, people are very resistant to do that. And you could compare, especially if you focus only on Berlin, you could focus on regions which are very, very similar, where the people are willing to wear masks and are doing it, to other places where they are not doing it. And then you could systematically find out if this makes an effect. And so it is with many other measures we are discussing really very intensively, and where we do not have any result, any impact to show to the people. And so, for example, there's the big discussion now in the moment, if people are allowed to travel from an area where we have a high infection rate into other areas. And there's a big discussion about it, and nobody has any facts about it. So some people believe it could help to reduce the infection rate. Others say, no, that's absolutely nonsense. So I would say, before you start with a nationwide order and a nationwide regulation, there would be a good chance to prove it. Yeah? And I say, look, we have done an evaluation, and this could be done very rapidly, I think. And say, look, what's the logic behind it? Because maybe you can, in some of the measures, you can also question the logic behind it. So some of the things I think are obvious that it do not make sense. And so I think our methodological, we have as evaluators can contribute a lot to measure, to assess the impact of such measures, and to help to give these measures more legitimacy, because that's also a big problem in our countries. I think especially in Europe, that the people are now fed up with these measures. They don't want to stop their parties, and they say it should be over, but it is not over. So the only thing I think we can do is to convince people by showing it there is an impact. You can trust us. Maybe not the politicians. Maybe you don't trust them, but you should trust results coming from science.
Thank you, Reinhard. Very, very clear and elaborate response. Next question to Albert. So as you know, Albert, in the African context and also in other countries, many evaluations often involve international experts. Given the travel restrictions, this may currently not be possible that international experts are involved in evaluation initiatives, which also provides an opportunity space for national researchers and evaluators to play a much more prominent role in supplying evaluative evidence and to play a stronger role in designing, implementing, and discussing evaluative evidence. Do you see this also happening in Rwanda, and do you see that there is a capacity development effect of all the work that is going on monitoring and evaluation? Over to you.
Thank you very much, Jos. As I said, most of the monitoring and evaluation efforts related to COVID-19, they are now being, in terms of studies or evaluations, they are being coordinated by the expert advisor team, where we do have international experts, as well as national experts. And most importantly, we have the other team, which has been left beside most of time, which is the academia. So looking at that mixture of expertise, but also of areas of expertise as well, I think the national teams and the experts, they are getting that capacity transferred from those international who fortunately remained in the country because of the travel restrictions. And we try as much as we can to have that be that good practice of pairing people in terms of expertise, so that we can have the maximum capacity transferred to the national teams. So we are experiencing this, but I can say we still need to have those international experts, but we are really experiencing a change in terms of capacity at national level. Over to you. Thank you.
Excellent. Thank you, Albert. Then a question for Bas. The COVID-19 pandemic and the M&E activity around it, and especially the evaluations, maybe also provide an opportunity space for more citizen engagement with evaluations. So my question is, how can citizens become more involved in evaluation during these times of the current crisis? Over to you, Bas.
The first step would be to have them at the start of the design of the evaluation, so that they can be part of and take ownership. The second is to make sure that we address concern about all the misunderstanding, all the news around the pandemic. In many communities, as today, there are a lot of misunderstanding, a lot of what is called fake news around the pandemic, and also the fear and the real nature of this pandemic. If we can design a communication strategy to explain this to most people, to the community, then we have the blessing and the engagement throughout when we design and present the finding of our evaluation. There is WHO is conducting a survey to understand why there is a relaxation and even a relaxation of government measure. Professor Renga mentioned wearing masks or washing hands. Some people at the beginning of the pandemic in many countries, people were really religious in washing their hands, you know. But nowadays, people don't care anymore. Yeah. So social distancing in community where it's really difficult for people not to hug each other or not to shake hands. So if we engage community at the beginning of our evaluation, throughout the evaluation, and explain the need of certain measure, then we'll succeed in having them. Over.
Thank you very much, Bas. Very, very interesting response. Esteemed colleagues, I think we are coming at the end of the list of your questions. So let me give all speakers one brief opportunity to reflect on an open question that I would like to for them to chew a little bit on. So maybe we will start in the order of the presentations provided. My question that I would like to put to all of you is a very simple one. Given what is happening now in the COVID-19 pandemic, and given how national responses are to some extent supported by evidence on how the pandemic is evolving and evidence on how interventions are influencing the pandemic, as well as other effects, how optimistic are you about the role of evaluation in decision-making processes, not only in the context of COVID-19, but also more broadly? Will governments learn from this crisis? So that's my question to you. I think it's related to a question that I posed to you earlier, Reinhard, but I would like to start with you. Thanks.
Okay, thanks. Actually, I hope that the political class will learn about, in the COVID crisis, about the importance of evaluation. But actually, I'm not so much optimistic if I have a look at the last few weeks. And again, in general, if I look at the results of our studies about the institutionalization of evaluation in European countries and in countries in Americas. But I think, it has also to do with the question as you asked, how can the civil society much more participating in evaluations? So I think what's missing in most of our societies is that the people do not know really about evaluation. And I think it's a big task for the evaluation societies, because actually they should act a little bit more as lobbyists. So in my understanding, if I have a look at Europe, so if I look at the European Evaluation Society, if I look at the German, Austrian Evaluation Society, they understand themselves as professional associations, yeah, that discuss professional issues with each other, and they may develop standards and they publish journals and so on, but they are not active enough as lobbyists, because they think that's maybe too offending, it's not compatible with the scientific morals and the professional ethics. But I think that's wrong, being that cautious, because if not we as evaluators support this idea that evaluation should play a central role in politics and society, who else should do it? So I think that's actually the message to us, to all of us, that we engage much more to convince people in the civil society and politicians, to use evaluations and in many different ways.
Thank you, Reinhard. Bas, may I ask you to turn on your video if possible? If not, that's fine. For you also the same question. How optimistic are you about the role of evaluation in decision making?
Yeah, can you see my video?
Yes. Mm-hmm.
Okay. And I like to echo Professor Reinhard on the last point. You know, we have a very, as evaluator, we have a very useful, a very important product, a goal. But what is maybe missing is the marketing. You know, every, like if you take Nike or you take Microsoft, there is a big push, a big effort to market the product. But as evaluators, do we market our evaluation and the usefulness of our evaluation to the end users? And maybe that's what Professor Reinhardt is alluding to, and I agree with him. Like, it's not only, yes, we have this different evaluation society, that's nice. We have this IPDET, we have all the training, is nice. But the end users, the percentage of end users who come to our meeting, who come to our training is very few. So it's for us now to design a strategy to go to the end user, politician or opinion leaders and community leaders and show them that the pandemic only strengthens the need for evaluation.
Thank you, Bas.
And resources should be put in there. So I'll finish with 2 words: sensitization and advocacy are important. Over.
Excellent.
Sorry for my excitement, but this is my topic.
Oh, that's good. That we should have passion for our jobs. Thank you. Albert, could you switch on your camera, please? And for you, the same question. How optimistic are you about the role of evaluation?
Yeah, thank you very much, Jos. I'm more optimistic than Professor Reinhardt and Basir, because countries and governments has got a chance to understand more the value of data and evaluations. And on top of that, they have been, it's obvious, evidence-based interventions have really yielded expected outcome. So I believe that countries and governments will ask more for evaluations. But also, I think this is an opportunity for evaluators, as Professor Basir was saying. It's an opportunity for evaluators to go back and revisit the strategies they used to use in order to sell this product of evaluation to the governments. Otherwise, I'm more optimistic than Professor Reinhardt. Thank you very much.
Excellent.
I hope you are right. And I'm wrong.
No, I'm very glad, Albert, that you are a bit more optimistic.
Can I say something?
Yes.
Can I add something? Albert, what you have, you have a comparative advantage. You have a government and authorities who understand the need of evaluation and who want to use evaluation. I have been in Rwanda, and I have worked in Rwanda with railways and what's her name? Oh, okay, so they have the government of Rwanda at the very start, even far before the pandemic, have made an effort to institutionalize evaluation, but also to use evaluation.
Yeah.
Yeah. So you have that advantage over all of us. Okay.
Thanks, Bas. Unfortunately, we are over time, so we need to close now. I'm glad we are ending on an optimistic note. I do think the intrinsic motivation in government is a very important basic starting point, and we hope that this will also be enhanced due to the crisis, that there will be a growing demand. We had very interesting presentations today by Reinhard Stockmann on the basics of M&E, but also on the validity of evaluation findings, legitimacy of evaluation, on different roles of evaluation. We had Bas talking about challenges in design of evaluations in the context of the pandemic, and different frameworks for that you might be able to use. And then we had Albert talking about very specific case of how an M&E system works in practice. I would like to thank all of the 3 speakers for very interesting presentations. Thank you, Reinhard. Thank you, Bas. Thank you, Albert. And also thank you very much to the participants. Thank you for your patience. Apologies for any technological glitches. And I hope you found the conversation interesting. And thank you very much for being here with us, and wishing you all a very good day, very good evening. Thank you.
Thank you so much, Jos and Jessica, for this nice seminar. We appreciate you guys.
Excellent.
Bye now.
Thank you very much to everyone
Thank you very much.
who contributed to the session. Thank you, and bye-bye.
Bye-bye.